here on Genetics for Healthcare, a central premise that we hold is, innovation doesn't mean much if patients can't access it. And in the 90s, there was an innovative company that reportedly sequenced, I guess I can say that in air quotes. So at the time, they sequenced the BRCA1 and the BRCA2 genes, and they were awarded patents. And they started to market a product that was reported as the first test that provided evidence of the connection between a genetic variant and risk of developing breast and ovarian cancer. There's good and there's bad about this stuff. The good is the data demonstrated that if a woman has a BRCA1 or 2 mutation, or a male has a BRCA1 or 2 mutation, it increased risk. But specifically, the data on this particular product showed that it increased the risk of a woman developing breast cancer by 50 to 80%, certainly big news, and ovarian cancer by 20 to 50%. That's a good thing to know that you have that risk, and there's modifying um, lifestyle measures, preemptive procedures that you can do to prevent a cancer diagnosis. Now, the bad part of that was that company aggressively blocked other researchers in labs who were further researching the BRCA gene to create more innovations because there was a lot more to learn that maybe was unknown at that time. And thankfully, on June the 13th, 2013, the Supreme Court issued an unanimous ruling that said, in part, that individual genes are beyond the domain of patent protection. Can't patent a gene. And then, secondly, in that ruling, it was said that genes are elements of nature, free to all men and reserved exclusively to none.